not, I make sure that if it's something going on, that I make sure it's on the website. I also update information from our Center for Disease Control Foundation, where the good information and trusted information is housed. Just to and I try to find personal stories
Yeah.
too to post. They want to hear, sometimes when the celebrities, get COVID, which more and more are, it's good that they come out with it, because more and more are saying, if I was not vaccinated, I'm grateful that I'm vaccinated because they could be sicker.
Right, right. Well,
And
see,
I,
mhm.
oh, go ahead.
Yeah, and so thank you for that. And
Mhm.
you mentioned like those personal stories which really resonate with people and it makes it real to them. So how has COVID impacted you personally?
Absolutely. Working in the pandemic at the hospital, the first round in 2020, I lost my brother. He thought he had COVID. He had a lot of the symptoms. He was a dialysis patient.
Yes.
Over 10 years, he had been receiving dialysis. So getting myself educated more and more in his honor really, really helps me. But he actually passed away of pneumonia.
Oh, I'm so
And
sorry.
pneumonia, thank you. Pneumonia and the COVID symptoms seemed to run hand in hand in our intensive care unit at the time. But I got that call while working in a hospital. And this was the reason why I came over to this role. Our hospitals were at capacity, where we were just filled up. And I just wanted to do something with a higher purpose, and found this role, and it's been so helpful. And I feel good at the end of the day about what I do. But it didn't stop there. Right around Christmas, I lost my uncle.
Oh,
And 1 week later, I lost my aunt, which was his wife.
oh my
He
goodness.
passed on Christmas Eve, and she passed on New Year's Eve. They were both unvaccinated with underlying health conditions. And
Yeah.
so it really, really turned my purpose and passion into keeping these conversations going, because then it became personal that I
Yes.
actually had a COVID-19 death twice, and during the holiday, 1 week apart. And just even watching my cousins have to go to the hospital and pick 3 people to visit,
Sure.
I really want to paint that picture in the community of how COVID can affect a family. We're used to surrounding the bedside when a loved one gets sick, but COVID restricts that visitation so much. Even them not being together, one was on one floor and the other was on the other.
Mhm.
Them passing away a week apart was just
Mm.
tremendous. We're still trying to recover from it.
Well, certainly, our hearts go out to you and your family and the tremendous loss that you've experienced. But what I can say is that you've been able to take enormous tragedies and it has empowered you. And then you have allowed it to become your life's calling and mission to educate and inform others so that they also can be informed and that they don't experience what you have directly. So we
Mhm.
definitely have to commend you and applaud you for that. And then to encourage you to continue your message and don't get tired, don't get weary, but
Yes.
continue the work to let folks know and tell me if there is um, something that you could say to individuals who are still not sure, if there's something that you can share with them that would certainly be reassuring, what would you tell them?
I love our slogan, which is "We can do it."
You can
We
do
can
it.
do it together. You don't have to do it alone. We have actually held hands of
Mhm.
our community members when they're scared. Some of them are scared of needles. Heck, I used to be scared to be at a hospital. I don't know how I worked in one, but whatever they need, a hug, as safely as possible. We want them to feel comfortable. We can do it, and we can do it together. You don't have to do it alone.
Mhm.
We can walk you through it. I can be contacted directly at 216-229-1100. And
Okay.
I'm at extension 245, or they can ask for Tiffany Stately. Um, but we're just going to continue to be out in our community. We're going to meet them right where they are the
Yeah.
community members. There it
Oh, we
is.
can do it. That's awesome.
We have those, you could put it on the refrigerator
Yeah.
or it's on the bumper of my car. So
Okay.
those are on our billboard. We had billboards and
Excellent.
bus shelter signs
Yes.
that had our message on it with pictures of people that look like us. So that's the most important. Sometimes my hair is the conversation starter, quite honestly, and it just goes from there.
Beautiful.
I talk to our community members in the grocery store. So
Right.
this is not a 9 to 5 for me. If a family member contacts me in the evening, I'm available. So, and that's the same thing. If I'm trying to reach a community member that's trying to get to one of the vaccination clinics and need transportation or
Yeah.
something like that, I'm making sure that I'm contacting them back.
Oh, great. So you are definitely getting the word out through all kinds of different ways. You're meeting people where they are. This is more than just a 9 to 5 for you. And not only that, but you're helping to really navigate some of the barriers and some of the obstacles that people may experience in trying to get to the vaccine clinics, correct?
Yes. Yep.
Okay.
Absolutely. Our community partners that we work with, it provides us with resources, even when they're not up to vaccination, just passing out that COVID-19 testing kit,
Mm.
really helps. It's a very good conversation starter to say, have you ever tested yourself? Or,
Yes.
when you feel symptoms, we're in the middle of flu season,
Mhm.
where a cold can't be distinguished between the COVID, or maybe you don't have symptoms at all and you might have been exposed, but,
Right.
they really appreciate the donations from our community partners that have been provided, which are the COVID-19 home test, as
Sure.
well as hand sanitizers and face masks, because we want the community safe.
Absolutely. Yeah, and I really appreciate you mentioning that because that's something that we do here at Neon too. We give out the home testing kits. We offer COVID-19 vaccinations at our Southeast Health Center and our Collinwood Health Center locations, and we even partnered up with the Huff Multi-Purpose Center on
Yes.
Wednesdays, where we're providing not only testing but COVID-19 vaccinations as well. So it's like we're partners. We're working
Oh,
hand
yeah.
in hand to make sure that we keep our community safe.
We've
Yeah.
helped out at a few of those, due to the fire at your other center on Huff. So
Uh-huh.
we've definitely worked with your staff that's been at
Yes,
the Huff Multi-Purpose Center.
great. Because
And
we
I
know
want to
how
say,
important it is.
go
Yeah.
ahead. You
Mhm.
go.
We know how important it is to continue to have a presence within our Huff community. You mentioned the statistics earlier, and so that helps to inform and guide, us in our service delivery, knowing where the need is, right?
Absolutely. I just saw on the news about the home test. Now that we've gotten the home test to our community, there's a lack of reporting if they're testing positive for COVID. So we don't know if we're up on another surge.
Yes.
We would have to probably determine it if our hospitals fill back up. So
Mhm.
I would encourage anyone that's taking it, if they test positive, to report it so that we can stay ahead of this pandemic. Without that information, then it's a reactive state of mind.
Well, that's such a key point. So again, audience, let's take heed. Make sure if you do test positive to report it so that we all know where we stand and how we are dealing with this constant changing pandemic. Very good. Very good. Okay, so I'm just going to ask you once again those telephone numbers, share with our listening audience the website in terms of how we can learn more about MOTTEP, organ, eye, and tissue donation, as well as the education about COVID-19 vaccinations and how important that is.
Well, my telephone number is 658-216-658-0716. We welcome an opportunity to give more information out about our organization and the programs that we actually implement in our community.
Excellent. Thank you so much, Ms. Kimble. Ms. Stately, you mentioned your telephone number, 216?
Yes,
Mhm.
229-1100, extension 245, as well as our website, clevelandmotep.org, or Facebook at Cleveland MOTTEP.
Wow. Ladies, this has been an incredible session. I just feel so much more informed now. I just feel so much more empowered, and I'm sure that our listening audience does too. On behalf of our president and CEO, Mr. Willie Austin here, and everyone at NEON, I would like to thank both of our special guests for their wonderful presentations, and not to forget Miss Monique Witherspoon, okay, for all of her hard work in bringing together today's programming, and of course to our partners, Molina and CareSource. Again, we want to thank each of you and to encourage you to continue to keep up the great work. Okay?
Thank you.
All right. Thanks to everyone, and we look forward to communicating with you again and having you on the show again as our special guest.
Have a great week.
Have a great week.